So when you smile, if anyone is pointing it out, oh, you have white teeth or you have good veneers, that is actually not a very good job.
Because a lot of people now just wants to get veneer done without knowing what is it for.
Invest in something that you get it done and then you're sorted. You're just maintaining it for another 10, 15 years. Don't get something done every year.
You know, the thing is, doctor, there are so many misconceptions because of social media. Everyone comes up saying that use baking soda, use baking powder, use this, use that. What is the worst trend that you have
First trend
seen?
is baking soda.
Really? I have
Like
tried.
no. And then you will, if you do it once, you might not see any adverse effect. But if you're doing it on a regular basis, your enamel surface is gone.
Biggest thing is what you eat, what you consume does also affect your overall oral health as well.
Yes, it does.
Yeah, and vitamins also play a very
Very
important role.
important role. Like your oral health tells
Yes.
a lot about your
Correct.
entire general health.
Over 85% of people living in UAE have dental issues, and not everybody is happy with their smile. This episode, that's why we decided to call a dentist, a cosmetic dentist in particular, to help us solve all our questions which we might be afraid to ask a dentist as well. So, do not forget to keep on watching this episode, and I'm sure there'll be a lot of takeaways for you. हाय गाइस, वेलकम बैक टू द फैट किड शो, जहां हम करेंगे गपशप एकदम ही अनफिल्टर्ड। अगर आपने मेरे चैनल को अब तक सब्सक्राइब नहीं किया है, डू नॉट फॉरगेट टू सब्सक्राइब टू माय यूट्यूब चैनल, फॉलो मी ऑन स्पॉटिफाई, एप्पल पॉडकास्ट, Amazon म्यूजिक, Angami, Jio Savan. We are there everywhere. And also, do not forget to thumbs up this video if you found a lot of takeaways. So today's guest is a specialized cosmetic dentist, and she has transformed thousands of smiles. We will be asking her all our doubts today and definitely get a lot of answers to them. She has been practicing here in UAE since 2015, and she's none other than Dr. Akanksha Srivastav. Hi, Dr. Akanksha. Welcome to the Fat Kid Show.
Thank you for having me.
How are you?
I'm good, thank you.
Yeah, Dr. Akanksha. First thing, when you go outside, do you analyze people? Oh, she can do braces. Oh, she can do veneers. Does that go to your mind?
It's always there since the time I
Yeah.
think I have graduated. If anyone is talking to me, my eyes automatically goes to their teeth. A lot of people have asked me, "Are you looking at my lips?" I'm like, "No, I'm looking at your teeth." I'm just thinking that what can be fixed.
Yeah. Tell me, what can I fix?
Oh, you have a beautiful smile. Like
Really?
I came in and I noticed you have well-aligned teeth. The teeth anatomy is nice. I think
Yeah.
for you, I have not examined in detail, but just get a regular cleaning, polishing, your oral hygiene sessions done, and you're fine.
You know, the thing is, one misconception that I've always heard every time I tell my mom that, or my husband, that I really want to go and get my teeth cleaned. No, teeth cleaning nahi karna chahiye. That will create a gap between your teeth.
Okay, I'll explain you why. So imagine if someone is there who has never gone to the dentist, and I'm now maybe 30 years old, and in this last 30 years, I have never been to a dentist. Automatically, there's a lot of deposit on your teeth. There's calculus deposit on the tooth, inside the gum area, and these deposit, in an attempt to have their own space, they move your gum away, they move your bone away, they even move a little bit of your tooth away. So then, if you get the cleaning done, the deposit is out. The deposit is like a stone deposit. Now that is out. You will feel empty in your mouth. That's how your oral condition is. That's your teeth gum condition. Rest of the space was just filled by deposit. So once that is out, you feel, oh my God, I have so much space between my teeth. My gum has gone down. I have sensitivity. All these issues were already there. They were just covered up by the deposit. So if you go to your dentist every 6 months, you will not have any deposit. You will not have that kind of deposit that will move away your gum or bone condition. It will be mild plaque and calculus over there that can be cleaned very easily in 15-20 minutes every 6 months.
Oh, that's great. And what about teeth whitening sessions?
So teeth whitening session is a cosmetic procedure if you want to enhance the color of your teeth. That is also decided, I think, by the doctor whether you are a good patient for it or not. So if someone who has gum, like tooth enamel erosion, they have sensitive teeth, all these problems are there, we don't do whitening for them. But someone like you have good set of enamel, your teeth is nice, everything is good. If you just get whitening done, your overall smile will be enhanced.
Yeah.
Whitening can be done again in a time frame of 1 to 1.5 years. If you want to repeat it, get it done every year or every 1.5 years, depending upon how well you maintain it.
Yeah, I drink a lot of coffee.
See, there's a trick. If you do something, there's not hardcore rule that you can never have coffee. You can have coffee. You can have black tea, you can have colored food too. You just need to know how to maintain it. So, like if you have black coffee every day, just after having coffee, drink a plain glass of water so that it just cleanses away your saliva. There's no content of color on your tooth surface. That's
So
it.
those people who actually do not drink water after tea or coffee,
They tend to have more stain.
okay. Yeah, because in India, they usually say that after drinking tea, don't drink water.
No,
Yeah.
that's really wrong. People say that अरे नहीं ठंडा गर्म हो जाएगा.
हाँ,
You know,
yes.
you had something hot, दांत crack हो जाएंगे. Firstly, the tea and coffee you're having, it's never too hot that your mouth will burn.
Yeah.
And your enamel is the strongest bone, so it's not going to have any effect on your enamel, okay, by the temperature. And then if you have some water, it's not going to be ice cold water either.
Yes.
So it's going to be a little cold or room temperature water. That's absolutely okay.
Okay. Doctor, in the past few years, cosmetic dentistry is rising a lot. What is the main, like, why do people come to you?
To enhance their smile. Okay. Now, people have this idea in their head that cosmetic dentistry means getting veneers done.
Yes.
Having opaque white tooth, those are cosmetic dentistry. It's not. If you see over the time frame, the trend keeps on changing. So, last maybe 10 years ago, 15 years ago, all the Hollywood celebrities, everyone was having those white opaque square shaped teeth.
Yes.
They were very well aligned, straight, and that was the trend. That was
was called
known
Hollywood
as
smile,
yeah,
right?
yeah, that was a Hollywood smile.
Yeah.
But over the time, people, patients, everyone started realizing that that looks fake. That is completely fake. It's not your set of teeth. So when you smile, if anyone is pointing it out, oh, you have white teeth or you have good veneers, that is actually not a very good job. When you smile, people should appreciate that you have good set of teeth.
Yeah.
Your smile is nice, rather than identifying the work that has been done. Okay, so again, coming to veneers and cosmetic dentistry, cosmetic dentistry is not all about veneers. Okay,
Yeah.
so if any treatment, I would say either it be Invisalign or composite bonding, whitening, gum recontouring, any treatment that is enhancing your smile is cosmetic dentistry. It's not only veneers.
What is the difference between veneers, aligners, and braces?
Okay, so I'll give you an example to explain it. Like, imagine you're doing a house renovation. So the things, if you're restructuring your house, you're getting one wall down, you're moving, making a bigger room. The restructuring is more like braces treatment. Okay, so we move everything. We can correct your bite, we can correct your alignment, your occlusion can be fixed, everything can be aligned. Okay. Now coming to Invisalign would be repositioning. So if you're just moving the furniture around and making sure that everything is symmetrical, all
Yeah.
those things, that is Invisalign or aligners. And veneers would be like having wallpapers on your wall. Okay, so we are just covering it for aesthetic reason. That's what veneer is doing in your mouth. So Invisalign works very well for the patients who have mild crowding to moderate crowding, have mild spaces between their teeth. We can see very good results with it. Whereas veneer is a treatment of choice when you are not happy with your teeth anatomy. Your tooth structure is not that great. They have stain, they are of different shape, there is mild spacing. All these things can be aesthetically fixed by veneers.
But are veneers like affecting your natural teeth as well? Like,
Yes, it
in
is.
a negative way.
Not really. Nowadays, no. But I would say there is both extreme. Okay, so someone if who has a lot of crowding, the tooth are overlapping, and you go to the doctor without getting any ortho treatment like braces or Invisalign, you directly jump to the veneers, then you're damaging your enamel structure. Because to make them straight, to have a proper anatomy over there, an alignment, curvature, we have to cut a lot of teeth. Okay, that might end up for the patient having crowns, root canal rather than having veneers. Okay, by definitions, veneer are very thin. They are zero point 0.5 to zero point 0.1 mm, and they only cover the front surface of your teeth. But if someone is covering your entire tooth to do a cosmetic enhancement, they are actually giving you a crown, not veneer.
Yeah, makes sense.
Yeah.
Because a lot of people now just wants to get veneer done without knowing what is it for.
That's why having a proper consultation and understanding all the options. See, I do understand we have a lot of patients who are like, "No, I don't have so much time," or, I can't wear braces, or there's a lot of other investment. It's an investment in you. So if you get 2 treatments done, first get alignment done by Invisalign or braces, and then get the smile enhanced by veneers, it's all an investment as well. But it's a long time investment. Invest in something that you get it done and then you're sorted. You're just maintaining it for another 10, 15 years. Don't get something done every year.
Yeah.
Okay, you invest a lot of money getting something that is quick, and then after down the line 1 year, 2 year, you start having gum problem, you start having bad breath, you are having cavities. So you're repeating that work again and again. So it's better to get it done the right way in the first time and go it for a longer run.
Doctor, are people actually still taking braces? Because
Yes, they do.
yeah.
See again, braces, Invisalign, aligners, and veneers. All three of them are excellent treatment, depending upon done correctly.
Yeah.
Okay, so like for braces also, braces are wonderful treatment of choice when we have kids who we know
Yeah.
that might not be very compliant with the aligners.
Correct.
We can just put braces, they do the movement, they do the intrusion, extrusion, repositioning, everything is possible by braces. But that requires certain things that you have to go back to your dentist every 3 weeks to get adjustment done. You have to maintain your oral hygiene. Don't change your dentist. I have seen, this is a trend in Dubai that I have seen, if someone has got braces fixed in their mouth in their country or somewhere else, and they keep on going for adjustment to different doctor, they are not actually helping you in any of the way, because braces treatment, the doctor who has started it has a vision for you, knows what they are looking forward from this treatment. If you're going every month to another doctor to get just the adjustment done, you're actually not going to see any difference. You just have braces in your mouth, you end up having them for 4 or 5 years with maybe gum problems now.
And no evident results.
Yeah.
Then what is the correct for people who do not have braces or invisaligns or veneers? A good set of oral hygiene routine, what is it according to you?
Okay, so brush twice a day. Brushing.
Do we need does electric toothbrush help?
It does. So there are so many good electronic toothbrush now in market. They identify the problem that you're doing. If your tooth is pressing too much towards your tooth surface, they will tell you. If you're not brushing enough, they will point it out. They clean all the surface. So yeah. So electronic, if you ask me, it's easier to maintain it rather than by the manual. But again, it's a personal choice. Some people are very particular about their brushing, so they like manual brush. They know what the strokes are. If someone who's always in a hurry and need to track it, you even have apps to see that how well you're brushing.
Yeah.
Your toothbrush is linked to an app, so electronic brushes are very good options.
With a manual brush, what kind of brush do we go forward for?
Again, there's not one universal thing, but if any regular person with good set of tooth, go from soft to medium brush. Do not use a hard brush.
There's a lot of misconception online when it comes to the dentistry. That's why these questions.
Yeah.
Some people say, oh no, the electric toothbrush doesn't work. Some people say that the manual toothbrush is not the thing right now.
Yeah.
Don't use like a hard surface brush. Don't
Yeah,
use
don't
like
use a hard surface brush, that I agree on. Use a medium or a soft. But again, you need to understand, like we are two people. You have a different brushing habit, I have a different brushing
Correct.
habit. Maybe one of us is just very gentle while brushing.
Yeah.
I'm doing circular motions, I'm not putting too much pressure, and I'm using a soft brush. End of the day, I'll feel that my teeth are not getting clean enough. Okay. Now, on the other hand, if you are using a mild brush, you're not using a soft, but you are an aggressive brusher. You are just fighting, making sure all the
Yeah.
surface is cleaned at one time. You will have enamel erosion rather than, doing any
Clean teeth.
benefit over there. So
Yeah.
you will be like, okay, medium is just eroding my enamel surface, I should use a soft brush. No. At this time, both of us need to understand what's the brushing technique, how much pressure we should put over there, which hand we should use, how much circular motion, which side should be brushed for how long. We need to learn the brushing technique rather than the brush itself.
Is like 2 to 3 minutes enough?
2 to 3 minutes is enough, but making sure that you're brushing all the quadrants. So quadrant is 1, 2, 3, 4. There is facial outside, inside palatal surface, making sure that you're reaching all the surface for the same time. Not brushing one area for like 2 minutes, you're talking and doing other things, and 30 seconds is for rest of the mouth. This is what a very regular thing is with the patient, that you see one surface, the gum is getting eroded or your enamel surface is getting eroded, you have more sensation, because in the morning when you're using your brush, you're just brushing one side and doing other things. You're making coffee and you're talking to someone, you're fixing something,
Or on the phone.
yeah, or the phone. You just end up brushing more towards one side rather than brushing your entire oral cavity.
So like a circular motion is something that
Circular, yeah.
we do it sideways.
Yeah, that also erodes your surface. If you're doing in a circular manner, you're cleaning inside the gum area also. Like this, you're just brushing, wearing off the enamel surface.
But this is the very typical habit that
Yeah,
people
it
have,
is,
right?
yeah.
Yeah, so that's brushing twice a day.
Brushing twice a day and flossing twice a day. Flossing is as important as your brushing.
1 minute, doctor. So,
Okay, yeah, so flossing and brushing, both are equally important. Brushing is cleaning 70% of your tooth structure. Flossing is in the areas where your teeth are in tight contact. So if this is your teeth and there is space over here, these areas are cleaned by flossing. That is 30% of the surface not cleaned if you're not flossing.
So flossing, for that, do we have any technique?
It's just a floss, like put it inside. If you see, again, I believe if I go in the advanced technique that you go inside and you just squish it in one side of the gum, on the other side, those are advanced technique. You can learn it. First start doing it. First do the basic. Pick up a floss and try and struggle a little bit. Do the flossing over there. There are few videos that you can see. It's a super easy thing to do.
There is also these water flosses.
Water
that-
flosses are amazing as well. But again, both of them are required. So if I say flossing is very good for tight contact, so someone who has tight contact, the food is not getting stuck over there, a regular person, if with all the teeth very well aligned, flossing is good. Water flosser is very good if you have a little bit of space over there. Space more than the tight contact. Okay, so food is getting stuck over there. Or if you have implants, crown, veneers, to clean the circumference area with water pressure, that's excellent. But I won't say that water flosser is completely replacing flossing. No. If you're doing, do both of them.
What about the toothpaste?
Toothpaste, yeah, there are so many toothpaste in market.
Yeah.
I still believe fluoride toothpaste are for the win. If you're using on a regular basis, use a toothpaste with good fluoride content, ADA approved. Don't fall into the trap of having a charcoal toothpaste or whitening toothpaste. They actually do not do much for your teeth. If you have a lot of stain, if you're a smoker or a coffee drinker, and then you use a whitening toothpaste or a charcoal toothpaste, they remove the stain. They are a little abrasive in nature.
Bleaching?
So, charcoal toothpaste is a little abrasive.
Yeah.
So they will just remove the top layer of your enamel surface slowly and slowly. That makes it a little whiter and the stain is not there and you feel that it is working for you. But if you continue using it for years, you will see that your tooth is becoming sensitive. And they won't be even white anymore because the top layer, the enamel layer, is a little whiter. If you have used for 15 years an abrasive toothpaste, your enamel layer is gone. Now the dentine layer is yellowish in color. That can never get white. No amount of whitening, office whitening or office toothpaste can make that whiter. Then you have to go for other cosmetic treatments like getting composite bondings or veneers on top of them if you want to enhance it. That's why don't use a charcoal toothpaste. I'm not a pro charcoal toothpaste
So a
fan.
good fluoride toothpaste is something that...
Yeah, let's go for fluoride toothpaste.
Okay, I've brushed my teeth, I've flossed my teeth, then what?
Just have
That's
your
it?
yeah, that's it. Floss it, brush
Mouthwash?
it. No, okay, mouthwash also. I would say not choose your mouthwash very nicely. It should be an alcohol-free mouthwash. And if you really want to use it, don't use it every day. Using a mouthwash maybe once in 2-3 days is enough. You don't want to, there are good bacteria and there are bad bacteria in your mouth. You don't want to have an empty room, okay? So that there is no good bacteria and no bad bacteria. So just use while the mouthwash are working, they clean everything. There's nothing good, nothing bad left inside. It's just a dry mouth. So that's why don't use it on a daily basis. Use it maybe in 2-3 days once. That's enough.
What about the teeth whitening strips that we get in the market?
Again, anything done in a controlled area. Like if you do office whitening, we control everything. The material that we use has controlled hydrogen peroxide. The way we apply it, there is gingival barrier. It doesn't come in contact with your gum or any other place. So it's a very controlled whitening, office whitening. Whereas the home whitening strips, they are not controlled. They do not have, firstly, that high percentage of hydrogen peroxide that they show any difference on your teeth. Apart from that, when you use it, most of the time patient cover their teeth, cover their gum, and you start having irritated gum. Your gum becomes a little whitish or inflamed. You have sensitive teeth. So not really, no. Like anything used, I'm telling you, if you use it in a wrong way or use it every day without consulting your doctor.
Yeah.
So if you want to use whitening kits at home also and you talk to your doctor, they will advise you how to use it and when to use it. You don't have to use it every day or you're using direct non-stop for 6 months. No. Like if you get office whitening done and you want to maintain it, we'll advise you how to cut the whitening strips so that your gum is not damaged. And you can use it 2-3 days in the night. That's it. And then you can maintain your whitening results that you have achieved in the office rather than achieving a whitening result from the night strips.
Yeah. You know, the thing is, doctor, there are so many misconceptions because of social media. Everyone comes up saying that use baking soda, use baking powder, use this, use that. What is the worst trend that you have
First
seen?
trend is baking soda.
Really? I have
Like
tried.
it's such, if you put it in water, you see all this foam coming out. It is very abrasive in nature, and people just put the powder and start brushing their
Yeah.
teeth. It's so
I've done
abrasive.
that.
No, and then you will, if you do it once, you might not see any adverse effect. But if you're doing it on a regular basis, your enamel surface is gone. You don't have
Yeah.
enamel surface left. Then from having the white teeth for 1 or 2 days, after that, once the enamel surface is gone, you are left with this yellow
Yellow.
dentine. Yeah, so no, it's very, very abrasive in nature.
I've also seen lemon used for teeth.
See, again, if you do on and off something, okay, that is just not your regular habit. Once lemon is so acidic in nature that it will erode again your enamel surface. So if you have just done once in a month something because you wanted to get rid of something, that's fine. That's not going to damage your tooth. But if you make these things as your habit, it's irreversible.
Because it's temptation, right? I do
Yeah.
it once, I see the result, and I want to do
Yeah.
it again and again. But we don't realize that tooth has layers inside,
Yeah.
and protecting is the enamel, which really we need to
So
protect.
true, yeah.
Yeah, so this is the thing. For me, as a non-doctor, as a non-science person, I will always think that tooth is just like one block of like maybe like calcium or whatever. So this is the biggest thing. So nobody talks about what happens when you do all of this.
Because all the trending TikToks and reels that you see about it, they are showing you their current state. They
Yeah.
won't show how their teeth is going to look like down the line in 5 years when they are just bad. So they have a
Yeah.
non-stop sensitivity. They have a eroded enamel
Yeah.
surface.
What about the oil pulling? I
Oil
wanted to
pulling is
ask.
good. Oil pulling is good.
It's good for the oral
It's good
hygiene.
for your gums. It's good for just teeth and gum maintenance. You can do it every day. There's no harm in it. If you squish with the coconut oil or sesame oil, it's good.
Does it not kill the good bacteria?
No, it doesn't. See, again, oil pulling is again something that is very, it's, there's no abrasion in it. There's no acidic effect. There is no abrasive effect. So if you're doing it, it's like a home remedy to maintain it. That's a good remedy.
Yeah. Is there any other home remedy that you think really works and one can try?
See, I'm a dentist. I don't try a lot of home remedy.
No,
I
fair
can tell
enough.
you the toothpaste and toothbrush to be used, but yeah, I don't try a lot of home remedy in me.
Do you
But
mind
yes,
telling the toothbrush or toothpaste we can use?
use an electronic toothbrush. Like currently it keeps on changing because there are so many new things
Yeah.
in market, but my current favorite is Oral B IO9 or IO7. It's very much control the vibrations, the pressure, everything, and they have this small head bristle, so they are not this long heads that they cover three teeth or two teeth at a time. They are round single head, so that you can reach till your wisdom tooth very easily. So I like that.
And what about the toothpaste?
Any fluoride content. So Oral B is
Which
also
is your
good.
favorite?
I'm
Oral B?
Oral B. I'm not sponsoring it. I'm not sponsored by them, but again, I am an Oral B fan.
Yeah, for me, it's like whichever is going to whiten my teeth.
No,
Maybe
so if
Colgate
you're going to
Optic
use
White.
it, don't use. See again, if you're using Optic White, I am not saying that no, never use it. If you use it for 4 5 days, good enough. Go back to your regular toothpaste. But don't use always like for 6 months non-stop. You're using Optic White. No.
Yeah, sure. What about when it comes to choosing a cosmetic dentist or a dentist in general? People think that cheaper, I will go there, I will get it done. What is the difference between going to a great dentist and a bad dentist? Like, not bad, but like an average dentist.
See, as a patient, I think a patient can make out a lot of things while they get their first consultation done. When you go through the doctor and you talk to them, how much they listen to your concern and the way they are addressing to it. So if you come to me in pain and I will listen to your problem, what it is, my first treatment of choice would be considering treating your chief complaint, and then giving you advice what else is going wrong, to give you the treatment options and letting you think about it, that take a decision. These are the plan that can be done, these are the problems. You can figure out where do you want to prioritize and how you want to start with it. If you're going to someone, I think just for cleaning maybe, or with a pain complaint, and they're just, no, let's just do Veneers for you, that's not a right treatment protocol, I believe.
Yeah.
And if something is very cheap, like cosmetic treatment cannot be that cheap. There should be a good amount of investment in the material that is being delivered in your mouth. So they should be biocompatible. They should not wear off. They should stay. They should have a color in it, aesthetic in it. They should stay in your mouth for 10, 15 years. All these things come with a cost, initial lab cost. So if someone is providing you something for way cheaper that is in the market, then they are compromising somewhere
Yeah,
something.
because there are a lot of offers when it comes to veneers,
Yeah,
braces,
yeah,
and
I've seen
aligners.
that.
Yeah, even teeth whitening for 99 dirhams.
Yeah, so what? Even cleaning is not done
Yeah.
in 99. So how can anyone
Yes.
do whitening?
Yes. So that's the thing. But what about right now? What else do you think affects which happens regularly? Like maybe some food that affects the oral health, the dental health.
Sugar. Sugar is just an enemy of your teeth and your entire body, I would say. It's not good for your enamel structure, your oral. You have more cavities if you have more sugar intake.
When we say sugar, is it the liquid sugar or like chocolate solid sugar?
Any sugar. The sugar content inside your mouth. So that thing will feed the bacteria that create cavity. So you will tend to have more cavities in general. That's why the people who have more chocolate or sugar content, they have more cavities, because you're feeding the bacteria that cause cavity.
Yeah.
So that's why sugar. The second thing I would say is acidic drinks, like all the cola, soft drinks. They are just so bad. They erode your enamel structure completely.
In UAE, more
In
than 100 liters of soda is
no,
consumed per year by
no,
one person.
I know.
It is crazy.
Yeah.
What about coffee and tea? I know we discussed this, but like eventually, when we keep on drinking, it will still not
See, again,
yellow well.
anything in excessive is going to damage it. Okay, not only your teeth, your body as well.
Yeah.
So if you're someone who is having a lot of coffee the entire day, a lot of tea the entire day, firstly your teeth will get stained, and then your mouth goes into a dehydrating phase.
Yeah.
So the saliva production goes down. Saliva itself is a self-cleansing agent. It removes the food particles, it cleans your mouth the entire day because saliva is always there. So
Yeah.
if the flow of saliva is reduced, your tooth is not being cleaned, self-cleansing as it should be. And the chances of you having cavities, all the bad bacteria growing inside your mouth goes higher.
What do you think are like the top good food for teeth and oral health? Do you have any recommendation?
Have fruits. Yeah.
But that sugar will not cause cavity.
No, 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 not that. See, again, the added sugar, the white sugar, the brown sugar, all those things destroy your teeth surface. But if the natural sugar, there's not much sugar in fruits. So if you have apple, you have banana, you have watermelon, all these things are going to neutralize the acid as well as just be very good for your overall gut and mouth health.
And what about any supplements?
Oh yeah, I do believe if you should get everyone should get checked what is their vitamin D level, B level, all those things, and then take these supplements because nowadays we have seen a lot of patients coming in with a very reduced vitamin D and a very reduced vitamin B. So if B complex or vitamin B12 is less in your body, the patients tends to have more ulcers in their mouth. So we are able to identify a lot of problems in the patient's general health by just seeing their oral concerns.
Yeah. And how do we get rid of like bad breath?
See, bad breath is not because of one reason. There are multiple reasons
Even gut
behind
health
it.
plays an
Yeah,
important
it's
role.
a very important thing. So, your mouth is the door for your gut health.
Yeah.
Okay, whatever goes inside is going to affect not only entire body as well as your oral cavity.
Correct.
So if you are someone who is having a lot of sugar or acidic drinks like colas and everything, firstly your gut is going to respond to it. It's going to create a lot of acid inflammation inside,
Correct.
and that is going to be reflected in your mouth too. So there will be teeth enamel erosion. Your gum will be inflamed. All these things are related to your gut health.
Yeah. So how do we take care of that? Like for oral hygiene, do you have
Just take care of your entire health. So change your food habits. Don't have first thing in the morning. I've seen a lot of people having in breakfast donut and
Yeah, yeah,
black
for
coffee.
sure.
No, never, never. Firstly, don't spike your sugar level like
In the
that in the
morning, yeah.
morning. Don't do that. Have milk or have water. First thing in the morning, just have plain glass of water so the entire acid is being flushed out. Don't just load your body with caffeine or any other tea, anything like that in the morning.
Does sleep also affect that?
Sleep, whatever you're doing the entire day, your mouth is going to respond to you in the nighttime in your sleep. It has such a great relation that most of the time patients don't even realize it because
Yeah.
sleep, if you're doing anything in the nighttime, mostly in your mouth, it's a subconscious habit. So you cannot control it. The first thing that we as dentists can notice is night grinding. Sometimes the patient will come and they have like no complaint. They're sleeping well. They say, no, I don't grind my teeth. We can see a pattern that the entire occlusal level is becoming flat because they're grinding. They tell us that they get up in the morning and they are still tired. They have this jaw pain over here. All these are the signs and symptoms of night grinding. They even develop, if you ignore it for a longer run, you have not paid attention to the jaw pain that you're happening. Down the line in few years, if it is aggressive night grinding, you'll start having clicking sound in your jaw. So that's your TMJ problem now
This is
happening.
subconsciously that happens.
Yeah, so if you are not having a proper sleep, you are overwhelmed, you're anxious, you are not getting proper rest, your sleep pattern is disturbed, don't have a fixed sleep pattern. Some days you're sleeping at 10, some days you're sleeping at 2 o'clock in the night. Your body is just going to respond to it. So you aggressively clench or grind your teeth.
Like this?
Yeah, there's clenching, the noise will come, and the grinding is just grinding. So a person, if you even have a partner who's sleeping with you, if you're just clenching your teeth, they will not know the noise.
No.
Okay, so they say, no, my partner is also not. Firstly, both of you are sleeping, so no one is
Yes,
noticing who's
yes.
grinding or not. But again, it's just a habit that cannot be controlled. It's your body responding to, I would say, stress. We see a lot of patients who are just doing a lot of night grinding and they go on vacation, suddenly the grinding is gone. So your body and your grinding is related in a huge manner.
Wow, this is new information because I didn't know something like this
Yeah,
existed.
it does.
Yeah.
And it becomes a little difficult sometimes to explain to the patient, showing them that, you are grinding. The best thing is now that a lot of people are practicing. We even have iTro scanners. So every time the patient come in for a consultation, we do the scanning. We have the exact copy of your teeth in our record. We as a dentist also see 10 or 20 patients a day. We don't remember every single
Yes,
patient's
yes.
tooth anatomy. So if you come to me after 6 months, I'll do a rescan. And then we can compare both of them, that where the enamel has gone down, if there is any minor movement, some changes, everything can be seen by the patients by themselves and understand, okay, this was my teeth condition 6 months ago, this is the enamel wear down I have now. So now dentistry is also so advanced that it's easier for us to make patient understand. Before this, there was a lot of, we see it and we tell
Yeah.
them and they're like, I don't believe you. I don't think
Yeah.
I'm grinding.
Yeah.
Until unless it's too much.
Yeah. But then the thing is, how do we control that?
See again, we can control the grinding by changing the lifestyle, and we can protect your tooth meanwhile by giving you night guards. So the habit will change by determining what actually is bothering. So do you have a irregular sleep pattern, a diet habit? Are you eating and then going
More
off
of
to
the
sleep?
mental
Yeah,
aspect.
like your in general lifestyle has to be fixed on that. Whereas while we are fixing that, it's not an overnight thing that we
Yeah.
do it and tomorrow you're fine. It takes months and years to get to a regular habit. So meanwhile, you start wearing an occlusal guard or a night guard. So it's fabricated according to your dentition. We scan it. It's a very thin. It depends from person to person grinding. So there are soft, medium, and hard. Depending upon what will suit your requirement, we fabricate a night guard, and you just have to wear it in the nighttime and go off to sleep.
It's
So
like a guard.
yeah, it's like, and it's a very thin card. It's not like the sports card that, it's very filling. So that's why I tell patients, don't buy anything from the pharmacy because it's not customized for you. The night guards that your dentist is making is customized. It's made according to your dentition, your teeth anatomy, the size of your jaw. So you wear it. Of course, when you wear something new, there is a mouthfulness for a few days, extra salivation. It's a new foreign body in your mouth. You will feel funny for a day or so, maybe for a week, but then you get used to it very quickly. And that removes the entire pressure from your teeth. So while you're grinding, it's a cushion-like thing. So your tooth enamel surface is not getting eroded. Your muscle is not tensed that much.
Yeah.
So in general, a lot of things are getting better by just using that night
It's
guard.
like doing a jaw workout every night.
Yeah.
Doctor, but this is something that's a very rare case scenario. Maybe not as rare, but people do breathe from the mouth.
Yeah, they do.
Does that affect? Because it
does.
causes dry mouth
Dry
all
mouth,
night.
yeah. So your saliva flow goes down if you're breathing through your mouth, and the bacteria then grows.
Do you think it's a very common problem
It's a
here
very
in
common,
UAE?
yeah. The people who snore, they do it. Some people just have this nasal blockage thing, so they are not comfortable breathing. Sleep apnea is there. So
Yes.
we have to, again, mouth breathing is not by one reason. There are multiple reasons. Again, consult your doctor. See what is your reason, whether you have nasal congestion, whether you have you're sleep deprived, snoring is a habit, another thing, sleep apnea, what is going on with you. Treat that thing, and
Yeah.
then your rest of the breathing habit will improve. I have seen a patient who was having nasal congestion and sleep apnea problem, and they saw online trend that use mouth tape
Yes.
and then sleep. I'm like,
Yes.
you cannot, everyone cannot use mouth tape. If someone who has difficulty breathing from your
It
nose,
is really viral on TikTok.
yeah, I know this is a viral trend. That it's not that not people should not use it. Someone who can breathe through their nose can use it. It helps. But someone who has nasal blockage or a deviated nose and is having actual difficulty breathing through your nose, if you use a tape, you will panic in the night and get up that you're not able to breathe
Yeah.
at all.
Yeah. You know, one of the weirdest problem I had while growing up, these teeth are really sharp.
Yeah, canine, yeah.
Yeah. And I used to keep on biting everything. All my t-shirts that I wear at home had holes in it. And my mom is like, "What are you doing?" I'm like, "I can't stop biting."
But
Is it?
canine are supposed to be sharp. They are
But I
the,
can't stop biting. Like, I just want to bite something. Not like eat bite,
yeah.
but I keep on want to
See,
bite
again,
something.
that's a habit.
Yeah.
Yeah,
So
like
it's
some people have this habit of biting their nails, or
yeah.
just some people even have a habit while they're working or they're focusing on something, they clench their teeth. You have this habit that you just bite on
Yeah.
something with your canine.
My mom is like, "Stop being a vampire. You can't be biting everything." But have you seen any weird such habit that people have when it
Yeah,
comes
people
to
have a lot of habit, like biting nails.
nails? Is
Adult having this, thumb sucking habit. Or there's a lot of habit, like just biting their lips when they're anxious. Some people have this habit of biting their soft tissue, like the cheek side area.
Yeah.
They just keep chewing on it while they're doing something.
Yeah. For the kids, when they grow up, I know this is very off topic, but like when toddlers are having their teeth or like when they're really small babies, the thumb sucking really affects their jaw, the tooth,
The eruption,
the
yeah,
eruption,
yeah,
yes.
the eruption of the teeth. See again, it depends which age they are lying in. So if someone is at a age when the tooth is erupting, maybe 6 months baby till 2.5 years when the tooth is erupting, yes, you have the urge of biting on something because your gum is getting irritated, itchy, and that soothes the child. So some people bite on their finger, thumb, or they have this pacifier or teethers
Yeah,
that they can just bite on. The easiest way to freeze a carrot or freeze a cucumber and give it to
yeah.
your child, that makes the gum a little numb, soothes the gum, and is good for the kid also. Yes, over the time period, if left unnoticed or not being corrected, some child do develop thumb sucking habit, and that's not a very good habit. So in general, if you are at a growing stage, your teeth and jaw, everything is being formed right now, your bone is also being formed. So if a child develops thumb sucking habit, they develop high palate,
Yeah.
so the palate goes very high inside. So all these things, and that has other problems with it. So yeah, if you see such habits, just break the habit. If you cannot break it at home by normal tricks, go
Yeah.
to your dentist. They will advise you. We have appliances for it to break the habit. So there are a lot of options available. I think now, because of the trend, it's like people jump into what they research online and they think that they can
Yeah.
do it because they are in control of the treatment, and they try that first rather than going and getting a professional advice.
Yes.
So go and get a professional advice first, because if it can be treated at home, if what you are thinking is going to work, you can discuss that with your doctor. And if it will really help, they'll advise you, yes, go ahead, try that. If that works, good enough. If it doesn't, then we can find a next step.
Yeah. Talking about all these trends, the one thing that's trending right now is Ozempic drug
Yeah,
for weight loss.
yeah,
Does that affect your tooth?
it does. Okay, but again, there are pros and cons both to it. It's a trending drug. A lot of researchers are still coming in. It's not very well defined. We have seen good results as well as, I would say, bad results with it. So now it comes how you're taking Ozempic. So Ozempic, if it is microdosing, okay, your doctor has kept you on a microdosing amount, like you are taking zero point 0.5 mg only, and it's not increasing every week or every month, then yes, we have seen good results with it. Good results in the sense that you have less craving, less sugar craving. You're not munching all the times. So in general, your oral environment improves. The sugar rush is not there. The acidic cold drinks or sodas are not there. You're not drinking the entire day, or you're not eating or munching the entire day. That helps with your saliva. Okay. Coming to the bad effect, I would say, when you're not eating, drinking, your craving has gone, what I suggest the patient, drink a lot of water. Because if you're not even drinking water, your mouth is getting dry mouth with Ozempic. So if someone who is having Ozempic and they're changing the dose rapidly, like from zero point 0.5 they went to 0.25, they went to zero point 0.5, and then 1 gram in a time frame of 15 days or a month, there's a lot of GLP-1 in your body, and that is just causing too much of dryness. Okay, so your saliva flow decreases a lot. At that time, if you don't take care of your teeth, like using fluoride toothpaste, or drinking enough water, your enamel is going to suffer. Even when you take higher doses, we have seen a lot of patients having acid reflux or nausea. That is again acidic in nature. So that is constantly in your oral cavity, and that is again eroding your enamel surface. So I won't say Ozempic is good or bad. It's up to the dose that you're taking. Anything in excess can damage it. Microdosing, studies have shown, is still doing wonders for patient.
Yeah.
Yeah.
So, and you spoke about dry mouth. So, just like drinking water really helps with dry mouth, or is there anything else that can be done?
So you can have this sugar-free chewing gums because they just stimulate saliva flow in it. So chewing on anything random, like any food, and having glucose spiked inside your body, just have sugar-free chewing gums. They regulate the saliva inside your mouth, so you
Are
will not
chewing
have
gum
dry. Yeah.
also something that is good, just not with dry mouth, but in general?
Not again. See, both things are subjectable. Chewing gums, when you have dry mouth, you can use it for some time, but do not chew on gums which are very sticky. So there are two kinds of gum also in market. There are one that are very sticky. They will just adhere to your tooth surface. They are not good for your teeth. So they stick to the fillings if you have, and they pull them out. Or they, if you have a crown, they will pull them out. But if you're having a chewing gum which is a xylitone one, not that sticky to your teeth, one a day is enough.
Because a lot of people who are working on desk have this habit. We have a chewing gum packet right there. And literally in my office, I work with marketing.
Yeah.
Everyone has a box
Chewing
of
gum.
Mentos there, and we'll be chewing gum all day.
Yeah.
Before lunch, after lunch, it's literally there. So does that affect with cavity
See,
as well?
if you're having sugar-free
Sugar-free.
one or two a day, it's not going to
But how
damage
long do
it.
we keep that?
But
That's
yeah,
also
again,
thing.
if you're chewing on your teeth for like 1 hour, 1.5 hour, or 2, 3 hours, that is also not good. So chew it just to make sure that the saliva flow is maintained, but don't chew that much that you're wearing your enamel.
Like half an hour, 15 minutes
Yeah,
is
that's
more
fine.
than
That's
enough.
enough.
Yeah.
But I have seen people who keep chewing gum for 2, 3 hours in their mouth,
Yeah.
and they're constantly chewing on it. That is not a good thing.
Yeah.
See, ideally, if you count the amount of time that our teeth are actually in contact, is the time that we're having our meal. I'm talking to you, my teeth are not in contact. If I'm sitting the entire day, I'm working, generally, in an ideal scenario, my teeth are not going to be in contact. The mandible is always lying, okay? It's free. It's going to be in contact when I'm having my breakfast, lunch, dinner.
Yes.
So overall time, if you see in 24 hours, your teeth is in contact for like 30 minutes, max to max 1 hour. But if you start chewing gum for 3, 4 hours, you are again putting your muscle over here in stress because you're constantly chewing, chewing, chewing. And your enamel surface is getting eroded. Your tooth is not supposed to be in contact for such a long time. So if you have from 30 minutes, your teeth are in contact for 6 hours, that's damaging for your enamel.
Wow. Didn't know this. It's like for us, chewing
Then
gum,
just have, I'm not saying do not have sugar free gums, have it, but anything you do has to be in limitation. If someone says, oh, chewing gum is good for you, that doesn't mean you mean 24/7 you have a chewing gum in your mouth. No,
yeah,
it's not like that.
yeah. When we eat food, does like the biting habit also matters when it comes to maintaining your tooth
Yes,
and health?
like put pressure. Some people, nowadays, I won't say in the adult it's going to change a lot, but if a child is growing up and you're not giving them hard tooth or to chew on and bite on, you're keeping more on purees and smoothies, it's does affect their gum growth, their jaw growth, their teeth growth. Everything is dependent upon how well you're chewing, what food you're chewing,
The strength.
the strength, the alignment.
Yeah. But for the adults?
Adults too, like don't just completely stop using hard food. Like in adult, I think they were using all kind of food consistency. Okay, so people say that if you chew chewing gum for a long time, you have very strong muscles over there. It's absolutely not like that. You're
No.
stressing them out, so you will have more angulated muscles.
Yeah, yeah. Because a lot of people still can't eat even sugar cane. The raw form of sugar cane is something
Yeah.
that people can't chew on. So yeah.
That's the personal strength, or that's your how your dental health is.
Is there any other tips that you have when it comes to maintaining a good dental health?
Brush, floss, and I would say just please visit your dentist every 6 months.
Are
See,
people still scared to visit dentists? I am.
50-50. See, again, you have yet not been introduced. Okay.
Yes.
So choose your dentist wisely too. Go get in. If you're a first time patient, I suggest first appointment should only be for consultation.
Yeah.
Okay. If you have never done anything in your mouth ever, the first appointment should only be consultation. Understanding what your problem is, what your concern is, what all things are going wrong, what has to be corrected, and having a detailed conversation about it with your dentist that, what treatment should be done, what is priority, what can wait. Don't just go and in the first appointment you have a cavity without any discussion start doing fillings. No, discuss. The more you're aware, as an adult we like to be in control. So the more we are aware, the more we know what is going on inside my mouth or with the treatment, what will be done today, what will be done in the next appointment. You have a certain control on the treatment as well, and that gives a sense of relief. But if for the people who are just going in and getting treatment done without knowing much about the treatment, the pros and cons, how long it's going to last, whether it's required, is there any other option, then it becomes a little scary experience for them. So they
Yeah.
were not in control, they went in pain, and the tooth was pulled out.
Yeah, the knowledge and the consultation
Yeah.
is something that we really need to. Okay. Yeah. Okay, doctor. I think overall the basis is to, if you have a good oral hygiene, a good oral routine, a lot of problem can be solved.
Yes.
And the biggest thing is what you eat, what you consume does also affect your overall oral health as well.
Yes, it does.
Yeah, and vitamins also play a very
Very
important role.
important role. Like
Yeah.
your teeth, your mouth is the door. Whatever goes inside your body will be reflected in your mouth and in your entire body. So be
Yeah.
very wise in picking up what's going inside your mouth.
Yeah, because we always talk about skin, hair, and body,
Yeah.
but nobody really talks about oral health. We'll still take care of our nails, but oral health is
Yeah,
something that's last.
you see that people getting pedicure, manicure done. It
Yes,
doesn't charge you less. If you're getting a good pedicure, manicure done, you're spending a good
yes,
quality
yes, for
every
sure.
month. But getting 6 months cleaning done, they will think twice. Oh, whether it's actually required or not required.
Yeah, yeah. Even if somebody has a bad breath, instead of focusing on their gut health, we keep on using mouthwash or chewing
Mouthwashes,
gum.
yeah.
This is literally that happens.
And you know what? Your gut health tells, or your body tells a lot about, your oral health tells
Yes,
a lot about your
gut.
entire general health.
Yes.
So there is different people have this bad breath, halitosis. Halitosis can be of different smell also. So it's not only bad breath, there is fruity smell, there is a little dead smell, there is metallic smell. All these are related with different cause, what is causing in your body.
So you can identify.
Identify it, yes.
Ah, wow. Great. Thank you so much, Doctor.
You're
We are at the
most
last
welcome.
segment, which is called as Unfiltered Sawal, and it is sweetened by Woka. I know we said we will not talk about chocolates or tea, but this is a hamper for you.
Thank
I
you.
have few questions. You need to tell me is it fact or is it false?
Okay.
Brushing harder makes your teeth cleaner.
No.
No.
False.
Whitening toothpaste actually whitens your teeth.
False.
Flossing is more important than brushing.
True.
More important.
True.
Yeah?
Like you have to do both, but if you want to start with flossing. Why? I'll explain you that also. Like once you're doing cleaning your teeth, floss first. All the things that are stuck in between your teeth is cleaned. Now when you brush, the toothpaste and the bristles are even touching in between the tooth area. So everything is being flushed out completely. You can floss before brushing, after brushing, but again, my regime is that to first floss and then brush your teeth.
Wow. Okay. You don't need to see a dentist if you don't have pain.
Yeah, that's your choice.
DIY braces with rubber bands can straighten the teeth.
No, never.
This was a trend
I
on
know, I
TikTok.
have seen that, and that will mess up everything. Like this time, I have seen people filing their nails by nail
Yes.
filer to make them straight. That is damaging your enamel. It's an irreversible thing. Your enamel will never grow back, and that's still something that damage we can do some composite bonding or veneers and restore it. While you're doing those rubber bands and moving your teeth position, you are playing with the basic structure. You will have a malaligned jaw, your occlusal problems, bite problems, everything would be there. And that the one thing that took maybe few weeks to show some good results with the band, you will end up messing up your entire occlusion for years.
Yeah. There's a doctor, there's a dentist for a reason. Let them do their jobs. Um, okay, mouthwash is necessary for oral health.
Not really. No.
Yeah. Okay, doctor, I think that's it. These were all the questions that we had. I did clear a lot of misconceptions so far, and this is for you. I'm just going to keep it here.
Yeah, thank you. Thank you so much.
So, we did have a lot of misconceptions, especially visiting a dentist. This is the biggest thing. For me, it was always that I just need to go if I have pain. But I think it's also important to find any underlying cause in case there's a cavity growing, which might not be a pain right now, but it can be later.
Yeah.
So this is one of the reasons why I think I would visit the dentist, and also not focusing on any of these online trends.
No, please don't. Yeah. See,
Yeah.
again, why we encourage all the patients to just come to us every 6 months when you don't have a problem, when you're coming to us with no complaint, no
Yeah.
pain.
Yeah.
The entire experience is going to be very different. But if you come to us in pain, you're already in pain. We are going to do other things to control the pain, but we cannot eliminate the pain completely. There's already infection, there is already uh, anesthesia will be required, some other procedure will be done. You will be more scared and anxious because this is your first time, and it will be imprinted in your mouth, in your mind,
Yeah.
that that is how dentist is. It's not. You can go for a regular checkup, just get a consultation done, get a cleaning done if required, and nothing else.
Yeah. Yeah. Thank you so much,
You're
Dr.
most welcome.
Akansha.
Thank you for
It
having
was
me.
great talking. A lot of misconceptions solved, as I said, and a lot of takeaways from the podcast. Some things are basic, but overall, good oral health is the key. And for a beautiful smile,
Yeah,
yes.
it is.
Thank you so much.
You're welcome. Thank you.
Thank you so much, guys, for watching this podcast. If you did enjoy, please do not forget to give a thumbs up, subscribe to my channel, follow us on Spotify, Apple Podcast, Amazon Music, Angami, and Geo7. And I'll see you next time with another guest. Bye.